Thank you, Leon. I'm a graduate student in Professor Paula Hammond's lab, and I'm representing the Connect Therapeutics team where we focus on polymer-drug conjugates for the treatment of osteoarthritis. I'm sure most of you know what osteoarthritis is, so I won't go into too much detail, but osteoarthritis is the degradation of the articular cartilage in your articulating joints in your body, such as your knee here, but can also develop in other joints in your body. Over time, as the disease progresses, these large lesions form in your once very, very smooth articular cartilage. With this tissue damage comes a lot of pain, inflammation, and immobility. Unfortunately, at this time, there is no way to slow down, stop, or reverse the progression of the disease, and so patients with osteoarthritis must resort to symptom mitigation, so a lot of pain relievers, anti-inflammatories, and rehabilitation. Once the patient gets old enough and the disease progresses to a certain point, the only cure for osteoarthritis is a total joint replacement. I also want to mention that osteoarthritis is the leading cause of mobility-related disability in the US and is also projected to increase in occurrence as the life expectancy and obesity rates increases in the US. There's a number of factors involved in developing osteoarthritis in your joints, but the number one factor, which accounts for 12% of all osteoarthritic patients in the US, is post-traumatic osteoarthritis, or PTOA. PTOA is defined as osteoarthritis that develops in your joints after a traumatic injury to that joint. So since there is a very well-defined starting point for the development of osteoarthritis due to PTOA, we have targeted this patient population as for the introduction of our technology into the osteoarthritic market. A typical timeline for a patient with PTOA is a traumatic injury at a young age, like an ACL tear at 20 years old, which increases the likelihood of developing osteoarthritis in that joint by 6 times. At 30 years old, the patient may now be suffering from common symptoms of osteoarthritis, like joint pain and immobility, and by 40 years old, the patient may have a completely immobilized joint, which severely hinders the patient's ability to enjoy everyday activities. The current method of trying to prevent osteoarthritis from occurring after a joint injury may involve some type of surgery, followed by rehabilitation to try to strengthen and increase the stability of the joint, and also corticosteroid injections to try to decrease the inflammation in the joint. However, the patient is still left simply hoping that osteoarthritis does not develop in the joint. That's where our technology comes in, where we have developed a drug delivery system that can be directly intra-articularly injected into the joint space to chemically block osteoarthritis from occurring after a joint injury. I need to mention that our technology is not a new drug candidate. We have developed a new drug delivery system for existing drugs. What I mean is there is a number of prospective and proposed disease-modifying osteoarthritis drugs in the market that have been pushed through clinical trials, but all have failed, mostly due to a lack of efficacy due to rapid clearance from the joint space. As an example, Amgen tried to push through clinical trials an interleukin-1 receptor antagonist, or IL-1RA, which is an anti-catabolic drug FDA approved for use in rheumatoid arthritis patients. When Amgen tried to push these through phase 2 osteoarthritis clinical trials, the drug failed due to a lack of efficacy, which Amgen concluded was due to clearance from the joint space. More specifically, all of the drug was cleared within 24 hours. So that's where our technology comes in. We have taken a positively charged polyamidoamine dendritic polymer and covalently bound and optimized a number of polyethylene glycol chains onto the surface to create this biocompatible polymer that has patches of positive charge that can form electrostatic interactions with the negative charge of articular cartilage. We can then take this polymer and covalently bind biologic drugs or proteins onto the surface to increase the retention time in the joint space. We tested this hypothesis in rat knees and found that using our polymer-drug conjugate, we were able to increase the retention time 10 times over that of the free drug, meaning the free drug was cleared completely from the rat joint space within 3 days, but our polymer-drug conjugate was able to have efficacious drug levels in the rat knees up to 30 days. So now we have engineered this polymer and covalently bound these biologic drugs to the surface. And we also optimized this formulation such that the biologic drug does not lose any bioactivity. What I mean by this is the orientation of the drug on the polymer is in such a way that the drug is able to interact with the drug receptor in the same way it would if it were a free drug. We then attached this pro-anabolic insulin-like growth factor 1 or IGF-1 protein onto the surface of our polymer and tested this polymer drug conjugate versus the free drug in a rat PTOA model. What we found was our technology was able to decrease the severity of multiple clinically relevant osteoarthritis endpoints versus the free drug. What this means is our technology is able to increase the therapeutic efficiency of the free drug. This increase in drug efficacy comes from the increase in retention time within the joint. That is, if we take biologic drug candidates that have failed in clinical trials because they are evacuated from the joint space within a matter of days, and we conjugate them to our drug delivery technology, we can increase the duration of therapeutic doses within the joint up to 30 days. This increase in retention time allows the drug to work for an extended period of time, and we have shown that this is able to reduce the severity of osteoarthritic degradation. So with our technology, we can dramatically reduce the number of adults with joint pain and inflammation as a result of a joint injury at a young age, which also translates to less joint replacements of older patients due to post-traumatic osteoarthritis. With that, I would like to thank the Connect Therapeutic team and thank all of you for listening to how we are trying to eliminate joint trauma as a factor that contributes to osteoarthritis.